There are some physical ailments that are now being attributed to this problem. 3 new ones on the list. Dr. Pablo Zeballos joins us now, Fox News Radio medical specialist. So, Doc, if we're dependent on these smart devices, what are the new problems that we're seeing for using them too much?
Yeah, we've got some new problems, and one of them is called WhatsAppatitis. WhatsAppatitis is based on an app called WhatsApp that a lot of people around the world use for texting. So basically, this is a texting overuse injuries of the thumb. So that's the biggest one at this point in time.
So what kind of injuries are you doing to your thumb? I guess if you some people use one finger, right? That's an age thing, I guess.
If you look at most of these teenagers, they use both of their thumbs, and they do it at such rapid speed, and they text so much that we're seeing a lot of what's called repetitive stress injuries, a lot of overuse injuries of the thumb. And what ends up happening is you can have a lot of inflammation of the tendons at the joints where you're having this thumb, and that can cause significant amount of pain. And we're seeing a lot of younger kids basically coming into a clinic that we've never seen before.
Okay, so, I mean... Okay, I couldn't send enough. I couldn't send enough texts in my life to do that. But I mean, is there something other than the parents saying, "Give me that stupid phone," and moving on? I mean, is there some kind of a treatment for it?
I think telling them basically to use their other fingers. Don't just use your thumbs repetitively. Because you can actually use your other fingers. If you exchange your digits, you may not text as fast or as much, but you can actually lessen this stress injuries. Number one. Number two is also don't use texting so much. You can actually pick up the phone and call and talk to people. That actually works pretty well nowadays.
Oh, blasphemy!
And,
you mean
number three is just limit the amount of time that the kids can use their smartphones throughout the day and throughout the weekends.
Now, I see this next one, and Steve talked about it a little bit earlier, tech neck.
Mm-hmm. Yes, so tech neck is also, we're seeing a lot of that, especially on younger patients with 20 to 30-year-olds. I see a lot of that now. And patients will come in with a lot of neck pain, headaches, and all that is because when you're looking now at the phone, every time you walk around and you look at anybody looking down at the phone, they're at about a 60-degree angle of the neck. And having your neck at a 60-degree angle, it's almost like putting a 7-year-old kid on top of your head and looking down. And that's the amount of stress that you're putting on your neck. And when you do that, that actually causes inflammation and degeneration of the disc and the joints and narrows the canal where the nerves come out. So you can end up having neck pain going down the arms, and obviously headaches.
Your head is heavy. Well, some are heavier than others. Let's talk about smartphone pinky. We've discussed the thumbs being used for texting. How are we injuring our pinky?
Yeah, the smartphone pinky is, if you actually look around at your colleagues right now, they're using their phone with their smartphones. And if you remember, the smartphones they used to go smaller and smaller, and now they're going back to being so much larger and heavier. And so the smartphone pinky is where you put all the pressure and all the weight of your phone while you're texting on your pinkies. And usually that's okay if you just text once in a blue moon. But if you're doing that continuously, which we're seeing a lot of people doing, for hours at a time, you start getting a deformity of the pinky at the joints where the mid shaft of the pinky is. You start actually seeing like a little curvature, almost like a C, and that can actually cause long-term, obviously, deformity unless you stop that.
Wow! And there you have it, friends. Wouldn't you just pick up the phone and make a call? Use the actual call feature. Talk to the person sitting next to you. For the love of all that is holy.
I mean, isn't that amazing? That's amazing.
Dr. Pablo Zeballos, we appreciate your time. Medical specialist with Fox News Radio.